Mr. Tiberi is recognized for 5 minutes.
Thank you, Madam Secretary. Welcome to our committee. Thank you for being here. 3 points and then a question. First point is, I had a constituent who met with CMS late last year over a program that he believes will save, and he has documentation on this, $200 million a year to CMS and also save beneficiaries. He was kind of laughed out of the building, he said, because that wasn't very much money. We sent a follow-up letter to CMS and have been given kind of the brush off. I would like to send you a letter.
I'd
have
appreciate
your staff
that.
look into it. Thank you very, very much.
$200 million is real money.
I agree. Second issue is you and I had a discussion last year when you were here about my godmother who just lost her physician because he began not accepting not only new Medicare patients but getting rid of former Medicare patients. And just a week ago I received a letter, a copied a letter that was actually sent to your boss, the President of the United States, and I spoke to this doctor who I've never met before or talked to before. Her name is Deborah Moritz, and I'd like to read you part of it. It says, dear Mr. President, I can no longer afford to take new Medicare patients. I've seen a lot of inadequate management of Medicare patients, including my own parents. We can no longer afford to spend the time it takes to address multiple problems Medicare patients face. Rather than trying to accept that inadequate time or cost, I have decided to decline seeing new patients. I just can't afford to treat them. A free market, even if only for 3 to 5 years, would eventually level out the cost so that the true cost could be assessed. I'm not even going to address the burnout all of these issues create. All my colleagues express concern that we as doctors won't even be able to get medical care when we retire because all the good doctors are burning out and quitting. Mr. Chairman, I'd like to submit this letter for the record along with a attachment that she included from a medical journal entitled Government Medicine is Hazardous to Your Health. Again, I think it's a problem. You don't need to comment on it.
Without objection.
Thank you, Mr. Chairman. I think it's a problem that continues to occur throughout our nation. Final issue that I'd like to see if you would answer a question on. The Bishop of Columbus, Bishop Frederick Campbell, put out a letter a couple weeks ago after the ruling that you put out. And I'd like to read part of it. This was sent out to his constituency within the Columbus Diocese, which also includes, according to Bishop Campbell, a number of schools and a number of charities. And I quote from his letter regarding the HHS's recent ruling. In so ruling, the administration has cast aside the First Amendment to the Constitution of the United States, denying to Catholics our nation's first and most fundamental freedom, that of religious liberty. And as a result, unless the rule is overturned, we Catholics will be compelled either to violate our consciences or to drop health care coverage for our employees and suffer the penalties for doing so. The administration's sole concession was to give our institutions 1 year to comply. We will not comply with this unjust law. And talking to Bishop Campbell, he believes the so-called accommodation recently issued by the President does nothing to remedy the problem and that the regulation encroaches on the religious freedoms and the First Amendment. CRS just put out a report saying that if employers, for instance, had 100 employees, Madam Secretary, and refused to comply with the mandate, there would be a $100 a day fine for each individual employee. So you could add that up to $3.65 million for the year. The Diocese of Columbus has many more than just 100 employees, all of whom, when they got hired, knew what health care they were getting. And the bishop and I talked about the President so clearly saying, if you like what you have, you can keep it. He said that over and over many times. My question to you is, if they refused the mandate, refused to violate their First Amendment, refused to violate their religious beliefs, and refused to pay the fine, what consequences as an employer will Bishop Campbell face?
Congressman, I think what you're referring to is a portion of the Affordable Care Act where we were directed to develop a set of preventive health measures specifically for women's health, which has been a missing piece of a lot of insurance puzzles for a long time. We turned to the independent doctors and researchers at the Institute of Medicine, who came back with 8 recommendations, well woman screening and domestic violence screening and contraceptive coverage and mental health services, which are often missing from parts of the plan. We then looked around the country at the 28 states which have mandatory contraception laws already in place, many of which existed from the mid-90s, and looked at the way those laws are enacted, particularly with regard to religious freedom and religious facilities, and proposed in the rule the exemption that was the most commonly used among states who had any kind of exemption. That rule was finalized at the end of January, and it fully exempts churches and church affiliates. We think it also applies to likely most parochial schools, many religious high schools. Those employers who are not fully exempt in the declaration in January would be given a year to comply, and we pledge to work with religious leaders around their religious objections. In February, I joined the President in announcing that we will be promulgating a rule which will, I think, both not only ensure religious liberty but also women's health benefits. And it mandates that insurance companies, not the providers, but insurance companies will be making available to women at their choice. We can also, we will have a provision dealing with self-insured plans who work through third-party administrators to make sure that anyone with a religious exemption will not provide or pay for or refer people to contraception services and maintain their religious freedom. On the other hand, we'll make sure that women across this country don't be, by the virtue of where she works or where her spouse works or where her parents work, have health benefits that are limited. So I think the accommodation made to religious providers, which doesn't come into effect for 18 months, is one that protects religious liberty, but makes sure that women's health services will be full and complete for the first time ever in the history of this country.
Time has expired, but I didn't hear what would be the penalty if
Thank you, Mr.
he
Chairman.
did not comply. To Mr. Tiberi's question, I know we're way over time here, but if you could.
I have no idea the hypothetical. I mean, I can, if you want to submit that in writing, I'll get you an answer in writing, but I don't have.
Thank you.